There are many questions that surround acupuncture, especially if you've never tried it. Right here, Dr. Tracie Leonhardt and Liana Kramer from Peaks of Health Metabolic Medical Center are here to discuss it and share details to help you decide if it's right for you. Welcome, ladies. How are you?
Oh, thank you.
Thank you.
Dr. Leonhardt, I feel like it's been a while. We're glad to see you here. And so this is new for you to be talking about acupuncture. Talk about expanding your practice and why this was so important to get Liana involved.
Well, one of the things I usually tell people is when we expand services, most of the time it's my patients who dictate the services. So a lot of my patients were asking me about acupuncture. Being traditionally trained in medicine, I didn't know much about it. So I started learning what it was used for. And it's, you know, it so complements what we do that it was a great addition to the team.
And what about for you, Liana, to be able to join Peaks of Health? The whole focus is on everybody's health and well-being. Yes. That fits into what you've been doing in the Bay Area for many years, it sounds like.
Yes, Peaks of Health is the one-stop shop. It has everything holistic and traditional medicine, so it's a great place to work, one of the biggest holistic centers around.
So patients were asking about it. What were patients saying, and what did you know about acupuncture that really stood out that you see the benefits?
Well, a long time ago, I had a back injury, and some of the normal things we were doing weren't working, so I actually had acupuncture back then. So I knew it was used for pain relief, but didn't know it was used for things like, you know, pregnancy, didn't know it was used for, you know, anxiety, migraine headaches. You know, so again, a lot of things that our patients have, you know, it was starting to complement them. Gut health. We have a lot of patients that have a lot of GI issues, and you can actually use acupuncture to help heal the gut.
Okay, so let's get down to the nitty-gritty. Like I was telling you before, I have never had acupuncture, and everyone's, I'm sure, first question you get, does it hurt?
These are hair-fine needles, thin as a strand of hair, and it feels like my fingernail is touching you. It doesn't hurt. You know, a lot of people fall asleep while they're getting acupuncture.
And I'm petrified of needles, so for me to get it, I didn't even know they were going in.
So how long does the process take if someone does decide to move forward?
They're with me for about 45 minutes.
Okay.
I put the needles in. You have the needles in for about 20 minutes, and then I take them out. I put some nice music on for you. A lot of people just, you know, get really relaxed.
Since you've been doing this for so many years here in Tampa Bay, what kind of feedback do you get from patients? Maybe that first-time patient or even that regular one that comes and visits you. What do you hear from them when they get off the table?
They're relaxed.
Yeah.
They really feel like they've had a full body massage, or, you know, they really feel very relaxed. And you can continue to do whatever you want to do throughout the day. There's no drawbacks.
So you mentioned some of the conditions that you treat, which I think is interesting, talking about anxiety, but then also like GI and actual health issues that have been diagnosed. What are some other ones that people maybe want to keep in mind? Maybe they've tried regular treatments and things aren't working out. Who does make an ideal patient?
Well, of course, you know, acupuncture is great for any kind of pain. It's great for any kind of stress, anxiety, depression, PTSD. It's great for any kind of gynecological problem. It's great for hypertension, insomnia. There's many, many things acupuncture treats.
I was going to say, some of those are kind of catching me by surprise here. How does it work? Say, for instance, the GI problems. How does it work?
Well, what happens is the needle is a foreign object to the body.
Okay.
So when you put the needle into the body, your body thinks something is happening. We need to attack that needle. So it's sending all the red blood cells, all the white blood cells, endorphins are flowing. The needle's not harming you at all, but your body thinks it is. So it is actually, I'm pinpoint targeting where I want your body to heal itself.
So like for, say, GI, you actually do follow the GI track to be able to place the needles there?
There's about 360 acupuncture points on the body. There's 14 channels, acupuncture channels, and these points are located on the channels. The channels flow into certain organs and into certain body parts. So there's some distal points that I would use for the GI tract, and there's some local points, yes.
And again, that was just an example that I threw out there. And I mean, I'm just listening to you talk about it. I see why it was so important to get someone with such outstanding experience to be able to help you.
I mean, in traditional medicine, we do some of it because we know there's referred pain to different parts of the body based on injury. Like if you have a gallbladder, you can get shoulder pain. So because the nerve refers up. So they're just basically using that to the nth degree.
Interesting. Well, again, I love when you're here. It's always fascinating to hear everything that you have going on at Peaks of Health. It was so nice to meet you, Liana.
Thank you.
And if you want more information and learn more about acupuncture, see if it's right for you, or just any more information on how Peaks of Health Metabolic Medical Center can help you, there's the phone number, there's the website. We really appreciate you ladies coming in today, as always.
You.
Thank you.
Today.